Hello and welcome to the Coping Cafe. I am Dr. Joe, and please visit us also at thecopingcafe.com. We also have live presentations at the Coping Cafe at the Long Grove Center for Emotional Health. With us today is Jen Navarro, one of our clinicians who is an expert in ADHD. She's certified. And today we're going to talk a little bit about your program, the Executive Functioning Program.
Yes.
So first of all, what's the definition of executive functioning?
Well, executive functioning is an umbrella term that takes into consideration all sorts of different disorders. Basically, when we talk about executive functioning, we're talking about our ability to organize, our ability to reason, make decisions, problem solve. Those are those main problem solving, decision making.
Those kinds of issues. So you know what, when I hear it, I always think of ADHD.
Yes.
So is that kind of the hallmark with executive functioning?
Well, yeah, ADHD is one of those kind of executive functioning disorders, along with maybe some sensory issues, someone on the autistic spectrum. All of those have to do with your executive functioning skills, your frontal temporal lobe of your brain, so the front part of your brain.
Okay, so it affects a lot of different populations.
Yes.
And so you developed a program.
I did. I developed a program
Okay.
with you, Dr.
Yes.
Joe.
Good stuff.
So
tell us about the program.
So together we developed a 12-week program that could be done with individuals or in groups, basically for adolescence. As my teaching background would suggest, I worked with younger kids, second graders mostly, but elementary school kids. And it's basically teaching kids how to be very intentional about how to organize themselves, how to plan their day, how to manage their time, teaching kids those basic skills that maybe are difficult for them to follow.
So a big part of the program is CBT based. So we've heard a lot about that. I know we've done other coping cafes on cognitive behavioral therapy. And in a nutshell, really simply put, it's how our thoughts, feelings, and behavior are all interrelated. And I think it's an important component with this population, right? With kids with ADHD or executive functioning issues. So what are some of the things that you did in terms of the modules or, working with the CBT stuff?
Right. So really we wanted to focus on that CBT with that positive self-talk with kids, because getting a diagnosis or a label of ADHD or anxiety or any other kind of label that a child might receive can be a big stigma for them, and maybe even a detriment to their self-esteem. So what we want to do is make sure that we're teaching them those skills, those positive self-talk skills, teaching them how to use that, also self-monitoring their behavior, as well, using their skills to help them stay focused and pay attention, all of those things that make them a more successful student in the classroom, make them more successful with their social relationships as well. So incorporating that as looking at the whole child and not just looking at the academic portion, but their whole self and their behavior, family dynamics, and so forth.
You know what it sounds like, and I think what you did a really good job with, is this whole kind of toolbox, this kit, right? So you're hitting it at a lot of different levels in terms of organizational. You'll walk through with them with that. The CBT, the stinking thinking.
Yes,
right?
the thinking thinking, yeah.
And you also have a parent component.
Right, because it's really important that the parents understand and are on the same page. With us and with the kids. So the kids get that same message across the board. They get that same support as they get when they come into the office or into the group or into the classroom. Basically, so everybody's on the same page, working for the same goal for that child, and making them be successful, basically. And so giving them all the tools that we can.
And I think, too, you'd mentioned before just your work as a teacher, how well-rounded. Right? So how do you think that background that you had, that professional experience, how do you think that helps you in terms of being a social worker and working with this population?
Well, it gives me that real world experience of being that classroom teacher and knowing what those expectations are and seeing those kids struggle in the classroom and being able to really relate to them and know what that's like, know what the expectations are on them, and working through some of that, because there is a lot of social anxiety in this classroom. There is a lot of peer pressure at whatever age it is. And nobody wants to be labeled the bad kid in class. And I think sometimes, especially the kids with an ADHD diagnosis or a child with some executive functioning issues, they're the ones who stick out. And, you know, not in a good way.
Yeah, sure. Well, and I also think, too, you're uniquely qualified just with all of that background to be an advocate for the kids in the school system, because you know it both. You know the clinical piece, you know the teaching piece, and also supporting parents, right? Because, you know, this diagnosis or these issues affect the whole family oftentimes.
Absolutely, absolutely. So really bringing parents in, getting their feedback, their input is essential.
I always say that in terms of, I work a lot with more adolescents than younger children, as you do. But I think you can't do therapy with kids without having that component with the parents.
Right. Absolutely. Absolutely. Parents are, you know, they're the ones, you know, they're the ones the kids spend the most time with.
So I'm excited about your program.
I am too.
Very cool. Thanks so much. And join us next time at the Coping Cafe. I'm Dr. Jo.
And I'm Jen Navarro. Thank you.
Take care.